Chairman, I yield back.
Now recognize Ms. Lesko from Arizona for 5 minutes of questions.
Thank you, Mr. Chairman. Thank you all for being here. Dr. Marks, we spoke over the phone back on August 10th of 2021, and I was asking about VAERS because I had lots of constituents reaching out to me saying there was tons of adverse effects, there was thousands of deaths, et cetera, and they were very concerned. And I asked how many were confirmed. And at that time, you said 4. There were 4 cases that you confirmed deaths of that were caused by the vaccine. And I suggested at the time that the CDC and FDA do a better job of telling the public not just how many cases were reported, but how many were actually confirmed. And just, if I heard you right, just recently you said, well, we don't want to give out too much information because of privacy rights. But certainly we could put out how many were confirmed deaths, couldn't we?
Congresswoman, thank you so much for that question. I fully agree with you that we probably have not done a good enough job of communicating sometimes the actual numbers of deaths versus what's in VAERS. In fact, we just nearly fell prey to it here at this hearing. There are only handfuls, and I'll ask Dr. Jernigan to comment on this as well, handfuls that we can actually associate with the
Can I ask
vaccine.
why you haven't done it? I mean, this was August of 2021. It seems very logical to me that if you're saying people, the public shouldn't count on VAERS because anybody can report to that, which they can, why wouldn't you as actively report to the public, well, we confirmed this really low number of cases that actually were caused by vaccines? I mean, it's been years now. Why haven't you done it?
We did present that in various settings, including at, I believe, at the Advisory Committee of Immunization Practices. It was mentioned at our vaccine advisory committee. It perhaps did not go as broadly.
Is there an easy place for the public to find this? I remember you gave us some kind of link back in 2021, but it was really difficult to get to, if I remember right. And so why not spend the time like making, if the goal is to give confidence to people in getting vaccines, why in the world would you just not say, okay, what we have done is we've investigated these deaths, we've done this, we've done that, and we've only found, you know, a handful. I mean, it doesn't make any sense to me, but I want to continue. I'm sorry, I have only a short period of time. One of my former constituents, and I think I talked to you about this, Dr. Marks, from Surprise, Arizona, Steve Winger, worked for a company that forced him, mandated him to receive the COVID vaccine in May of 2021. He got the J&J vaccine. Within a month of receiving the vaccine, he was in the hospital paralyzed from his neck down. He spent over 3 months in the hospital and was eventually diagnosed with Guillain-Barré syndrome. And actually, the doctor has said right on his medical stuff that it was most likely caused from the vaccine. Steve continues to struggle with his injuries today, all because he was forced to take an experimental vaccine at the urging of the health agencies. Mr. Wenger's injury was also reported to VAERS, and he filed a claim with CICP about 2 years ago, he said, and has not heard back at all. He said not even a form letter. So I want you to know that, Commander, so that maybe my office can give you his name so you can at least respond that you got the claim from 2 years ago. Also, there was a New York man who suffered from HLH after his COVID vaccine. His initial report was classified as life-threatening. His second report, filed after his death, was classified as hospitalized. The family called to request a correction to the second report to be a fatality and was instructed to file another report and was then sent a form condolence letter from the CDC. And the fatality was in May of 2021. The form letter was received in December 2022. The family subsequently sent an automated message at the end of 2023 to update their VAERS report on his condition. He is dead, they said. The family has been very distressed by the lack of proper investigation done and classification that he's actually died. And so all I'm saying, I've run out of time, is that, as you have said, you've increased the number, Commander, from 4 personnel to, I think you said 35. Obviously, more work needs to be done if people haven't been, the person died and it still says they're hospitalized. I mean, this is a huge problem. And with that, I yield back.
I now recognize the ranking member of the full committee, Mr. Raskin from Maryland, for 5 minutes of questions.
Thank you, Mr. Chairman. Dr. Marks, you said a moment ago that the vaccine booster alone saved hundreds of thousands of lives. How many lives have been saved by the COVID-19 vaccine generally?
It's estimated in the United States, about 3.2 million lives, and it's estimated that globally, COVID-19 vaccines have saved over 14 million lives, conservatively.
And we lost more than 1 million people to COVID-19.
That's correct, about 1.1 million. I kept the daily record of the number of people dying, which got up to about 3,300, about a World Trade Center disaster a day.
Deborah Birx, who was former President Trump's White House coronavirus response coordinator, stated that a sequence of missteps and mistakes made by the prior administration's pandemic response cost hundreds of thousands of American lives. So I take it one of the points you have to make is that the public health response of the federal government makes a huge difference in terms of health outcomes for the American people.
I would agree with that.
Whether it's measles or tuberculosis or COVID-19, would you agree that vaccines save lives in the aggregate?
I think that by definition, for us to approve or authorize a vaccine, there has to be overwhelming evidence that many more lives are saved than might be taken by a vaccine. In other words, the safety profile by definition has to be excellent.
Gotcha. So, Dr. Jernigan, it seems as if one of the things that's created political or social conflict around this is the inevitable fact that even when vaccines save a huge number of lives, millions of lives, as Dr. Marks just testified, if in a small number of cases there are adverse results, the people who suffer them and their families are understandably very upset about that. Would you agree that that's a general conflict or dynamic that exists with all vaccines?
Correct. I think, we recognize that no medical intervention is risk-free. So that goes with medical interventions.
And I can imagine if I had a family member who suffered an adverse reaction to any vaccine, measles, TB, COVID-19, I would say, I just wish they hadn't gotten it in the first place. And of course, if anyone had been able to predict it, they would have been told not to get it. On the other hand, if we just said to everybody, there's a tiny number of people who suffer an adverse result, therefore nobody should get it, we know a lot more people are going to suffer and die because of it. Is that a basic problem that you wrestle with in your field, Dr. Jernigan?
Correct. I think anytime we're talking about public health measures, we have to think about the risks and the benefits, and the way that we communicate that is very important so that people will take those interventions.
Have you detected anything at the CDC through your surveillance systems that has caused you to doubt the safety or the appropriateness of the CDC's original and continuing recommendation that people get vaccinated against COVID-19?
So, I've dedicated my life to public health, and I do care deeply about protecting Americans and using the best available science. And I want to stress that the COVID vaccine is safe and it is effective. We have safety monitoring systems in place that have detected certain signals. We've acted on those quickly.
Would you agree that the COVID-19 vaccine and its rollout in the Biden administration has been one of the great achievements of modern science and public health.
I think over the last 4 years, we've had a once-in-a-lifetime event that required an incredible response from all of us, and so would agree that the use of vaccines has been a remarkable achievement for us all.
There's a paper that someone sent to me called Excess Death Rates for Republicans and Democrats During the COVID-19 Pandemic from the National Bureau of Economic Research, which makes the point that there have been substantially higher excess death rates for registered Republicans when compared to registered Democrats, and this has been connected to vaccine hesitancy or fears. And I'd like to submit this for the record, but I just wonder if you would opine on this for a second. Have we ever seen a case like this in the past where there's actually partisan differences in people's willingness to get a vaccine, their skepticism, and then death rates arising from such differences?
I think you point out the importance of us getting to so that folks can be vaccinated. Sorry.
Thank you very much, and I'll submit this for the record, Mr. Chairman, if I could.
I now recognize Ms. Green from Georgia for 5 minutes of questions, and without objection, submit it to the record.
Thank you, Mr. Chairman. I'm not a doctor, but I have a PhD in recognizing bullshit when I hear it. I'd like to point out to everyone that we knew early on, as a matter of fact, everyone knew early on, that the people that were at risk of hospitalization and dying of COVID were those that were obese, had diabetes, were over the age of 65. We also knew that children were at no risk, practically zero risk of being hospitalized or deaths from COVID-19. We knew that young people, healthy young people, were not at risk. However, Dr. Marks, you rushed through this process of authorizing these vaccines, even though you knew the side effects, you knew about myocarditis, and you knew about the studies. So let's be very real about the situation that we have. Here we have, let's talk about the reports on VAERS. Some people in here are trying to belittle these reports, but these reports come from people that died, people that got injured. And in December, in the middle of December, I think it was the 10th or the 11th, the first vaccine was approved. It was authorized under emergency use. Boom, 10,596 reports in less than a month. 2021, 706,767 reports on VAERS for vaccine injuries and deaths. 2022, it was 206,676. 2023, and it went going down because the mandates stopped. Now, let's talk a little bit more about the vaccines. Here we have reports. Deaths, 18,372. Permanent disability, 17,842. Hospitalizations, 86,452. Emergency room or office visits, 315,048. Serious adverse events, 113,449. This is from the Congressional Research Service about VAERS. All kinds of injuries, miscarriages, heart attacks, myocarditis, permanent disability, neurological problems, and it goes on and on and on. These are the reports from people being forced to take vaccines. Shouldn't have happened. Mr. Grimes, I've just told you the numbers of reports. However, under CICP, there are only 10,640 of these COVID-19 claims are currently pending or are in review. And as of January 1st, 2024, CICP only compensated 11 of the 40. Oh, wait. Let's make that number clear to everyone. Only 11 people have been compensated. Only 11 people have been compensated. Out of the 40 COVID-19 claims that determined were eligible, only 40 were determined eligible. That is amazing. And the average award was only about $3,700. On the other hand, the average VICP payout over the last 35 years is approximately $490,000. If you die or get injured from a COVID-19 vaccine, your average payout's $3,700. I'd like to recognize someone in the room today is here, Breanne Dressen. She's met with you, Dr. Marks. She's met privately with you about her vaccine injuries. She participated in a clinical trial. She was injured, and then she was dropped from the trial for the COVID-19 vaccines. Her medical expenses are $433,000 a year. She filed with CICP. Mr. Grimes, she's gotten no response. She's right here. Could you raise your hand, Ms. Dressen, please? Thank you. Perhaps you could meet with her after this meeting. Dr. Marks, you admitted to her that vaccine injuries are real, that they're real. Although you rushed through the authorization, and now you've authorized that children should receive these vaccines, and even babies as young as 6 months old. That is shameful. That's shameful. I'm not asking you a question. I'm going to continue speaking. Thank you. This is my time. The National Institute of Health also saw Ms. Dressen for her neurological complications that have been quite severe. They studied her, and then they dropped the study and asked her to be quiet about it. These are the real stories of the vaccine injured. They were totally, completely wiped off of social media. There's been thousands of peer-reviewed medical studies, thousands of them studying vaccine injuries. They are real. People are dying. People are having heart attacks, strokes, blood clots, and many other countries are dropping the COVID-19 vaccine and saying we shouldn't give them to children. It's time to be honest about the vaccine injured, and we need to stop allowing these COVID-19 vaccines to be given out to children.
Gentlelady's time has expired. I now recognize Mr. Garcia from California for 5 minutes of questions.
Thank you, Mr. Chairman. I'm sorry you all had to go through that. That was a lot of conspiracy theories and wild accusations, which we know have been debunked by medical science. And we should be clear that vaccines work and save lives, and they have millions of lives in this country. Now, it's really unfortunate that we're actually here having this hearing trying to poke holes and cause more vaccine hesitancy amongst the public. But we know that we're here because committee members on this committee have demanded that we have this hearing, and we continue to cave and give those members everything that they want. Now, we also know that we have a member of this committee that just actually made some comments, who's been on social media demanding that we hold this exact same hearing. This is the same person that we know that has, on countless posts, has spread misinformation, encouraged parents to refuse routine vaccinations for their children, which you just heard, by the way, and even compared our pandemic efforts responses to the Holocaust. I want to just actually read something which is in the public record. I'm not saying anything that's not in the public record. That a member of this committee actually said, the same person that is actually attacking vaccines, said that vaccinated employees get a vaccination logo, just like the Nazis forced Jewish people to wear a gold star. I want to read that again. Vaccinated employees get a vaccination logo, just like the Nazis forced Jewish people to wear a gold star. That is the level of insanity and attacks that we are having here as we actually debate the lives saved around vaccinations. Now, this same member has also held shadow public hearings promoting ideas that COVID is a bioweapon to target people of specific races and that vaccines, and I quote, cause turbo cancers. I want to read you this quote, and it's again in the public record at a hearing. Have the COVID vaccines resulted in an increase in cancers, and are turbo cancers real? Now, Mr. Chairman, this is, in my opinion, just insanity. We know that's not the case. Dr. Marks, can you clarify once again for the American people, do the COVID vaccines cause turbo cancers?
I'm a oncologist that's board certified. I don't know what a turbo cancer is. It was a term that was used first in a paper in mouse experiments describing an inflammatory response. We have not detected any increase in cancers with the COVID-19 vaccines.
Thank you. And I thank you for correcting the
But
record.
may I just add something here? I do need to apologize to the 1,000 or so parents of children who are under 4 years of age who have died of COVID-19 who were unvaccinated, because there were deaths and are continuing to be deaths in children, and that is the reason why they need to get vaccinated. Thank you.
And I agree with you 100%. And the fact that we are now having parents that are choosing to vaccinate their kids less than before because of all of the attacks on vaccinations is shameful, and it's shameful that members of Congress continue to put down vaccinations as an opportunity to get our communities healthier. And Dr. Marks, I want to thank you for the work that you did. My mom passed away to COVID-19. My stepfather passed away due to COVID-19. Both would have taken that vaccination in an instant if it was available to them. And so anytime that folks, especially folks on this, subcommittee on the pandemic, attack vaccines, it's personally insulting to all the families that have actually lost loved ones. We've saved millions of lives because of the vaccine. It's unfortunate we keep causing this harm. I just want to say, lastly, that Dr. Marks, do you agree that additional lives would have been saved? The lives that the folks that were not vaccinated, that we lost, over a million, obviously, in this country. Wouldn't a vast majority of those lives have been saved had we had the vaccine and they'd been vaccinated?
Multiple studies showed that 80 to 85% of the deaths that occurred were in unvaccinated individuals. So if we would have been able to reach a higher vaccination rate, it's likely that we would have had fewer deaths. And countries where they reached higher vaccination rates had fewer deaths per capita.
Thank you. And I encourage this committee and all members of Congress to encourage vaccinations across this country to save more American lives. With that, I yield back.
Now recognize Mr. Mfume from Maryland for 5 minutes of question.
Thank you, Chair Winstrup and Ranking Member Ruiz. I want to join in with the previous comments of members of the committee and welcome all of you again for being here with us today. Mr. Chair, I would also, on a point of personal privilege, remind members of this committee, even though I'm not the chair, that there should be some sense of decorum, and vulgarity should be discouraged. So if I ever say that I'm a PhD in BS, it means Bulgarian sunshine. You will not hear me talk about explicitly the thing that I won't mention here today. There are people watching across this nation who want, and quite frankly, really expect that the Congress, if no other place, will conduct itself in a way that does not insult any of them personally because of vulgarities, and in a way that we should, in fact, conduct business. Mr. Chair, the American ethic has always been one of independence and self-sufficiency. As a society, we see our health decisions as deeply personal and deeply private. In some instances, that proclivity towards individualism can lead to a hesitancy surrounding certain health innovations, such as vaccines. In the case of the COVID-19 pandemic, fearmongers amplified vaccine hesitancy, and it was done, as we all know, without necessarily substance or facts, but through fear, by way of news networks, late-night talk shows, and syndicated radio shows. Those talking heads, unfortunately, took advantage of certain communities' negative experiences with the American public health system by playing on fear and mistrust, and by amplifying over and over again a vaccine hesitancy across the nation. Now, when you do that, you really play with fire. In this case, the fire that the gentleman from California mentioned also about how we lose loved ones, how people die, and how that rate of death accelerated over and over again. I really want to thank God that Jonas Salk, the great virologist, in 1955, did not run into that nonsense when he developed the vaccine for polio. Parents were clamoring because they wanted their children to be able to walk and have a good life. There was a sense of sense and sensibility that went along with that. So when it's done right, it's done right. So many children and others were vaccinated for polio successfully. And were there some bad stories along the way? I'm sure there was. Just as we've heard, when you're dealing with science, there is not a 100% certainty in everything. Mr. Chairman, my colleagues on both sides of the aisle know that COVID vaccines, even under accelerated development timelines, have proven over and over again to be safe. I would ask unanimous consent, Mr. Chair, that I submit into the record this article from Vox, the general interest news site, entitled, "Will America Continue to Turn Away from Vaccines?"
Without objection.
Thank you, sir. Dr. Jernigan, can you explain for the committee again, if you don't mind? I mean, there's some people watching this around the nation who've tuned in late and perhaps missed some of the earlier discussion. Can you explain for the committee again, if you might, the multi-layered process of vaccine safety monitoring that the CDC implemented for COVID-19?
Thanks. And, I've worked in public health since 1994, responded to multiple infectious diseases emergencies, and this is the most robust vaccine safety monitoring system that we have ever had. There are 5 different systems. We use all of those to determine the impact of those vaccines and the association with safety. All of those systems are used by CDC.
And can you also corroborate that this seems to be, at least by all standards, an incredibly thorough process that meets and all the merits of scientific approach and scientific rollout for such? Why are these systems so crucial in maintaining and strengthening vaccine competency in the United States?
Yeah, I think, we want to make the best recommendations with the best available science. And so for that at CDC, we use a science-based process to get to those recommendations. And so making sure that science is first and making sure that we have the data and making the right recommendations with the best available science.
Thank you. I want to thank all of you again for being here with